Okay, thank you. So now I want to move to the topic of treatment options. So endocrine therapy is a class. It includes various treatment options. And I would like to take a few questions to help us understand the options and what's on the horizon, what's coming. So let's start with, there are various endocrine therapy drugs. Can you please help us understand the landscape, the different treatments, and how to choose between them?
Sure. So there are two main classes. There's a drug called tamoxifen, which is a estrogen receptor modulator. And then the other main class is aromatase inhibitors, and there are three of them. There's anastrozole and letrozole and exemestane. In general, tamoxifen works both in pre- and post-menopausal women, although it is used more frequently in premenopausal women. And the aromatase inhibitors work only in postmenopausal women, although they can be used in a younger woman in whom menopause has been induced. And menopause can be induced either by removing the ovaries surgically, rendering a woman postmenopausal, or by use of another type of a drug, which is called a GnRH or LHRH analog, which is an injectable medicine that induces menopause via the medication without removing the ovaries. So those are kind of the main classes.
Yeah, go ahead.
Go ahead. I was going to say the way that they work is a little bit different. So tamoxifen goes to that estrogen receptor that we talked about that the cells are expressing and acts right there. The aromatase inhibitors block the body from making estrogen at sites outside the ovaries. So as long as the ovaries are turned off or removed, it blocks estrogen production, thereby leading to less estrogen to stimulate the receptors.
Great, and maybe that answers one of the questions we got on the chat, which is, consider this patient case, 32 at diagnosis, 5.4 centimeter tumor, 1 positive lymph nodes. So that's radiologist told her she was stage 2A, did not tolerate tamoxifen, so did not take it for a year, had a total hysterectomy, and she started on the AI, but did not tolerate the aromatase inhibitor either. So her question is, I feel like having ovaries removed reduces risk. So is it really necessary to take the aromatase inhibitors? So maybe it goes back to how they work.
Yeah, so I mean, inducing menopause probably is one way to help prevent breast cancer from returning. We do certainly know from young women who get chemotherapy and go into menopause because of that, or from data from some recent trials where menopause was induced in young women, that doing that does contribute to reducing the risk of recurrence, but that really is not recommended as a sole therapy. It is recommended to do that plus tamoxifen or an aromatase inhibitor.